Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the question paper. The 5 questions are selected from JHI question paper, Junior Health Inspector question paper, conducted by the Department of Health Services in Kerala. So, explanation of the question and the answers and the options will be helping you to understand in depth with the topic. So, let me move on to the question. Organism can pass on characters that is acquired during its lifetime to its offspring. Who gave this idea? The question is, organism can pass on characters that is acquired during its lifetime to its offspring. Who gave this idea? The options are Darwin, Hugo de Vries, Lamarck and Wallace. Options Darwin, Hugo de Vries, Lamarck and Wallace. So the first option, we can analyze each of the options and what we know about each options. That will help us to reach to the correct answer. So the first option is Darwin, that is Charles Darwin. So he is known for his theory of natural selection. Charles Darwin is known for his theory of natural selection. So what does this theory states? Theory of natural selection. What is the meaning, or what does the theory states? The organisms better adapted to their environment are more likely to survive and reproduce. So the theory of natural selection means the organisms who are better adapted to the environment, they are more likely to survive and reproduce. So he does not propose that acquired traits could be inherited. He is not telling about the traits that are inherited. So the question here is the organism that can pass on characters that is acquired during its lifetime to its offspring. That means it is mentioning about the inherited traits, the chances of getting inherited, the acquired traits. So this option is not correct because Charles Darwin is mentioning about theory of natural selection, which is telling that organisms who are adapted to their environment, they are more likely to survive and reproduce. So this option is not the correct one. So we can exclude that option. Second one is Hugo de Vries. So he is recognized for his work on mutation theory. Mutation theory. He is known for his work mutation theory. He suggested that new species arise from sudden genetic changes or mutations. New species are arising from sudden genetic changes or mutations, not from the inheritance of acquired characters. So he is also not mentioning about the inheritance of acquired characters, but he is mentioning about the mutations or genetic changes. So this option is also not correct and we are excluding that option. Now we move on to the third option, Lamarck. So Jean-Baptiste Lamarck, his full name is Jean-Baptiste Lamarck. So he proposed the theory of inheritance of acquired characters. Theory of inheritance of acquired characters. So from the theory itself, we know the correct answer is Lamarck. Lamarck gave the idea of that organisms can pass on characters that is acquired during its lifetime to its offspring. So the theory of inheritance of acquired characteristics is given by Lamarck, or we will say the theory is Lamarckism. So what does he suggested? That the traits acquired during an organism's lifetime could be passed on to its offspring. Then the last option. So this is the correct answer. Option C, Lamarck is the correct answer. Then we have option D, Wallace. So he independently conceived the theory of evolution by natural selection. So he is like similar to the Darwin's ideas. He is again mentioning about the theory of evolution by natural selection. So he is not supporting the inheritance of acquired characteristics. So the idea that organisms can pass on acquired characteristics during their lifetime to their offspring, that is associated with Lamarck. So the correct answer is option C, Lamarck. So which are the other options we discussed? That is Darwin, he is concerned with the theory of natural selection. Hugo de Vries is concerned with the theory of mutation. And Wallace, he is again concerned with the theory of evolution. Theory of evolution by natural selection, similar to Darwin's ideas. So the correct answer is Lamarck. Now we move on to the next question. Question number 12. All are cause-specific categorization of adverse events following immunization, AEFI. What is AEFI? Adverse events following immunization. Adverse events following immunization. So there are different categorization, and the cause-specific categorization is mentioned. All are cause-specific categorization except. So which are the options? A. Immunization anxiety related reaction, immunization error related reaction, unknown reaction, and vaccine product related reaction. So all are cause specific categorization of adverse events following immunization. So the question is concerned with the classification of adverse events following the immunization, and regarding each of the option, first one is immunization anxiety related reaction. So these reactions occurs due to the stress or fear associated with the immunization. So the immunization anxiety related reaction is associated mainly with the stress or fear associated with the immunization. So there can be fainting or vasovagal syncope or hyperventilation or psychogenic reactions. So there can be stress related reactions like hyperventilation or fainting or psychogenic reactions. So these are all immunization anxiety related reactions. Then we have option B. Then immunization error related reactions. Immunization error related reaction. So these are adverse events caused by errors in vaccine storage, handling, preparation or administration. So there can be adverse events caused by the errors during vaccine storage, or it can be any errors associated with handling of these vaccines or preparation of the vaccines or even the administration of vaccines. So just an example, administration of wrong vaccine or administering incorrect dose. These are error related problems and error related reactions. So that is also cause specific categorization of adverse events following immunization. Then there is unknown reaction. So this category is not cause specific. So this is not cause specific. This is not cause specific. So it represents the events where no clear association with the immunization error or anxiety is identified. There is no association found with these events and the reaction. So that is not cause specific. So this is the correct answer, because this is the question is that all are cause specific except. So this option A is cause specific, option B is cause specific, but option C is not. So that is the correct answer. This is the exception. Then we can check the option D also, that is vaccine product related reaction. So these adverse events occurs as a direct response to the vaccine components or the product. So there can be allergic reactions or side effects in the product which is mentioned in the product. So that is also cause specific categorization. So unknown reaction is the correct answer, because this is not a cause specific categorization under adverse events following immunization, because it does not identify the specific reason or root cause like the other categories. In the other categories we can find out the root cause. The cause is there. It is anxiety or stress related. This can be error associated with the vaccines or regarding the preparation or handling or administration of the vaccines. So these are all the different reasons or causes are there. Here the vaccine product related reactions we can see. So the option A, B and D are cause-specific categorization except the unknown reaction because it is not a cause-specific. So the correct answer is option C, unknown reaction. Now we move on to the next question, that is question number 13. All are true about mass drug administration in filariasis except. All are true about mass drug administration in filariasis except. Options are given to all above 2 years of age except pregnant and seriously ill patients. So mass drug administration in filariasis is given to all above 2 years except pregnant and seriously ill patients. Option B, it is indicated in highly endemic areas. So mass drug administration in filariasis is indicated in highly endemic areas. Then option C, mass drug administration in filariasis is given only if the people have microfilariemia or disease manifestations. So mass drug administration is given only if the people have microfilariemia or disease manifestations. So which is the correct answer? So the question is regarding the mass drug administration. Mass drug administration in case of filariasis, MDA, mass drug administration in filariasis. This is the question here. So the first option, it is given to all above 2 years of age except seriously ill patients. So we have the question all are true except. So all are correct answer regarding this point or regarding this topic except. So first option is correct. It is given to all above 2 years of age except pregnant and seriously ill patients. Option A is correct. Option B, it is indicated in highly endemic areas. That is also correct regarding MDA. That is also a correct answer related with this topic. Then, so because MDA is recommended for areas with high prevalence of filariasis to interrupt the transmission by targeting the entire community. So it is mainly focused on high prevalence areas. Then option C, it is given only if the people have microfilariemia or disease manifestations. So that statement is false regarding MDA in filariasis. This statement is false. Mass drug administration. So that means it is a preventive public health strategy that targets the whole eligible population. So this is targeting the whole eligible population is targeted here, not just those having the symptoms or testing positive for microfilaria. So not only for the people who are tested and are positive for microfilaria or who are showing the symptoms or disease manifestations. So this is not only particular to these people, but this is targeting the whole population, whole eligible population. So the goal is to treat the asymptomatic carriers as well as to eliminate the reservoir of infection. So what is the goal by targeting the whole population? Our goal is to eliminate the reservoir of infection and also treat asymptomatic carriers. So that is true. Option C, we cannot that this option is not correct because it is given only, the option is saying that it is given only if the people have microfilariemia or disease manifestations. So this is a wrong answer. This is a wrong answer. The statement is incorrect because MDA is not limited to symptomatic individuals. It is not limited to symptomatic individuals. So the correct answer, all are true except MDA in filariasis. All are true about MDA in filariasis except option C, given only if the people have microfilariemia. That is wrong. It is false about MDA in filariasis. Now we move on to the next question. Which of these is a live vaccine? Which of these is a live vaccine? Options. Option A is pentavalent vaccine. Option B is measles vaccine. Option C, tetanus toxoid, and option D is Japanese encephalitis vaccine. So which of these is a live vaccine? So first one is pentavalent vaccine. Pentavalent vaccine is a combination vaccine mainly against 5 diseases. Pentavalent means 5 diseases. Which are the 5 diseases coming under this category. First one is diphtheria. Diphtheria, first one. Second is tetanus. Tetanus. Pertussis. Pertussis or whooping cough. Then hepatitis B and Haemophilus influenza type B. Haemophilus influenza type B. Haemophilus influenza type B, or we'll say HIB. So this combination vaccine is, it is an inactivated vaccine. This is an inactivated vaccine. So combination vaccines or pentavalent vaccines are inactivated vaccine. This is not a live vaccine. We can consider this as a category of inactivated vaccines. Then we have measles vaccine. So the measles vaccine is a live attenuated vaccine. This is a live attenuated vaccine, meaning it contains a weakened form of the virus that stimulates an immune response without causing the disease. So live attenuated means it is having the virus which is in a very weak form that is causing just a stimulation of an immune response, but it is not causing the disease. So this is the correct answer. Option B, measles vaccine is an example of a live vaccine. Then what about option C, tetanus toxoid? This is not a live vaccine. This is inactivated toxoid. This is in the form of inactivated toxoid. Inactivated toxoid, meaning it contains an inactivated toxin to provide the immunity. It is having an inactivated toxin to provide the immunity. So this option is not correct. And the last option, Japanese encephalitis vaccine. Japanese encephalitis vaccine. So this can be either live attenuated or inactivated depending upon the specific type. Some are live attenuated and some are inactivated in Japanese encephalitis. So in most general use, the inactivated version is most common. The Japanese encephalitis vaccine, generally the inactivated vaccine is the most common one. So we cannot consider that as a live vaccine. So option B is the correct answer. Measles vaccine is a live attenuated vaccine, and the pentavalent vaccine, the option 1, pentavalent vaccine, or they are in the form of inactivated vaccine. Then tetanus toxoid is inactivated toxoids. Japanese encephalitis vaccine, it can be live attenuated or inactivated, but most commonly they are also inactivated. So measles vaccine is the correct answer. Now we move on to the next question. Question number 15. A severely malnourished child 6 months to 72 months of age gets the following calories and proteins per day through ICDS program. So the option 300 calories and 10 to 12 grams protein, 500 calories and 12 to 15 grams protein, 800 calories and 20 to 25 grams protein, 1000 calories and 25 to 30 grams protein. So according to ICDS program, how much is the severely malnourished child's requirement for 6 months to 72 months of age? According to ICDS program, how much is the severely malnourished child is getting from 6 months to 72 months of age? So we should know in this question the ICDS program calories and proteins per day the child is getting, which is a severely malnourished child. This is not a normal child, this is a severely malnourished child, and in the age group of 6 months to 72 months. So these are the key terms that you should be knowing. So ICDS, Integrated Child Development Service. Integrated Child Development Service. Child Development Service. So that is the program in India, and it is providing nutritional support to children, to pregnant women and to lactating mothers. What is the purpose? It is to combat malnutrition. So ICDS program, it is providing the nutritional support to children, to pregnant women and to lactating mothers to combat malnutrition in India. The program focuses on supplementary nutrition for children aged 6 months to 6 years. So the program is focusing on supplementary malnutrition for children from 6 months to 6 years. So the first option is 300 calories and 10 to 12 grams of protein. So this is the nutritional support which is given to normal children. This is the nutritional requirement or nutritional support given to normal children is 300 calories and 10 to 12 grams of protein. So this is not sufficient for severely malnourished children. This is the normal for normal children. Then we have option B, that is 500 calories and 12 to 15 grams of protein. So this is the approximate supplementation provided to pregnant and lactating women or older children who are not severely malnourished under ICDS. So this is the requirement for pregnant and lactating mothers. Pregnant ladies and lactating mothers. The requirement is 500 calories. 500 calories and 12 to 15 grams of protein. So this is not for severely malnourished under ICDS. Then we have option C, 800 calories and 20 to 25 grams of protein. So this is the correct choice for severely malnourished children. This is the correct choice for severely malnourished children aged 6 months to 72 months. So it aligns with the ICDS recommendation for additional calories and proteins to rehabilitate the malnourished children. So this is the correct answer. So for malnourished children, 800 calories are required and 20 to 25 grams of proteins. 20 to 25 grams of proteins. Option B is 1000 calories and 25 to 30 grams of protein. So this is not specified in the ICDS nutritional supplementation guidelines for children. Even for severe malnourished children also, this is not the correct answer. Not the 1000 and not 1000 calories and not 25 to 30 grams of protein. So this is the wrong answer here. Option C is the correct answer. 800 calories and 20 to 25 grams of proteins for the severely malnourished children, because they need high energy and protein levels to recover from their nutritional deficits, and that is why 800 calories and 20 to 25 grams of proteins are needed. So correct answer is option C. I hope this video is useful for all of you. So thank you for watching this video.